Hello all. In this video, I will explain about local anesthetic agent. First, we understanding the pain. So, when an injury occurs in the body, the specialized pain receptors called nociceptors present in the tissues are activated. And these receptors convert the physical or chemical stimulus into an electrical signals that can be transmitted through the nervous system. Once the nociceptors are activated, they generate an electrical impulses, and this impulses travels through peripheral nerves toward the spinal cord. After reaching the spinal cord, the signal is further transmitted through ascending pathways to the brain, where it is finally interrupted as pain. So pain is not actually felt at the site of injury, but it is perceived only when the signal reaches the brain and is processed by higher centers. Here, if the transmission of this pain signal is blocked at any point along the nerve pathway, the signal will not reach the brain, and as a result, the person will not experience pain even though the injury is still present. So, this is the fundamental principle on which local anesthetic drugs work, as they prevent the transmission of pain signals from the site of injury to the brain. Under normal condition, the nerve cells maintain a resting membrane potential in which the inside of the cell is negatively charged compared to the outside. When a stimulus is applied, voltage-gated sodium channels present in the nerve membrane open, allowing sodium ions to rapidly enter the cell. The influx of sodium ion causes depolarization of the nerve membrane, which leads to the generation of an action potential. This action potential then propagates along the length of the nerve fiber, carrying the signal toward the nervous system. Sodium ion entry into the nerve cell is essential for the initiation of and propagation of the nerve impulses, and without the sodium influx, the electrical signal cannot be generated or transmitted. Here we say about the mechanism of local anesthetics. Local anesthetic drugs exert their effect by reversibly binding to voltage-gated sodium channels present in the nerve membrane and blocking the entry of sodium ions into the cell. By preventing the influx of sodium ions, these drugs inhibit the process of depolarization, thereby preventing the generation of an action potential. As a result, the nerve is unable to transmit the pain signal, and the pain is not perceived by the patients. In simple terms, the local anesthetic drugs stop the nerve from sending the pain message to the brain by blocking the pathway through which the electrical signals travels. So you can imagine the nerve as a road and the pain signal as a vehicle traveling on that road. And the sodium channel act like a gate that allows the vehicle to pass. When a local anesthetic drugs block the sodium channel, it is similar to closing the gate. Okay, so the vehicle cannot move forward and the pain signal cannot reach the brain. So all local anesthetic drugs have a common chemical structure consisting of a lipophilic aromatic ring, an intermediate chain, and hydrophilic amine group. The lipophilic portion of the molecule allows the drug to penetrate the lipid-rich nerve membranes, while the hydrophilic portion helps the drug bind to the sodium channel receptors. Next, classification of local anesthetic drugs. Local anesthetic drugs are broadly classified into two groups based on the type of intermediate chain present in the structure, namely ester-linked drugs and amide-linked drugs. The ester group includes drugs such as procaine, benzocaine, and tetracaine, whereas the amide group includes drugs such as lidocaine, bupivacaine, ropivacaine, and prilocaine. The ester-type local anesthetics are rapidly metabolized by plasma cholinesterase enzymes, which result in a shorter duration of action, whereas amide-type local anesthetics are metabolized in the liver and therefore generally have a longer duration of action. Additionally, ester type drugs are more likely to cause allergic reactions due to the formation of para-aminobenzoic acid as a metabolite, while the amide type drugs rarely produce such reactions. Next, the pharmacokinetics of local anesthetic agents. The absorption of local anesthetic drugs depend on the site of administration and the blood supply to the area with highly vascular regions, leading to faster absorption and shorter duration of actions. Once absorbed, Once it absorbed, these drugs are distributed to various tissues with highly perfused organs such as the brain and heart, receiving the drug more rapidly. The metabolism of ester type drugs occurs in the plasma, whereas amide type drugs are metabolized in the liver by microsomal enzymes. Finally, the metabolites of these drugs are excreted through the kidneys via urine. Okay. Next, some factors affecting that actions. The effectiveness of local anesthetic drugs can be influenced by several factors, including the pH of the tissue, the degree of blood flow, lipid solubility, and protein binding of the drug. In infected or inflamed tissues, the pH becomes acidic, which reduces the ability of the drug to penetrate the nerve membrane, thereby decreasing its effectiveness. Next, we move on to the role of adrenaline. Okay. Adrenaline is often added to local anesthetic solutions because it causes vasoconstriction at the site of infection, which reduces blood flow and slows the absorption of the drug into the systemic circulation. This results in a prolonged duration of action and also reduce the risk of systemic toxicity. However, adrenaline should not be used in areas supplied by an end arteries such as the fingers, toes, nose, ear, and penis, because excessive vasoconstriction in these areas can lead to tissue ischemia and necrosis. And the local anesthetic drugs do not block all types of nerve fibers equally, and they tend to block smaller, unmyelinated pain fibers first, followed by temperature, touch, and finally motor fibers. This explains why pain sensation is lost before the loss of motor function during local anesthesia. Next, the lidocaine is the most commonly used local anesthetic due to its rapid onset of action and intermediate duration, making it suitable for a wide range of procedures. Bupivacaine is a long-acting local anesthetic that is commonly used for spinal and epidural anesthesia, although it carries a higher risk of cardiotoxicity. And ropivacaine is similar to bupivacaine but has a safer cardiovascular profile, while prilocaine is associated with the risk of methemoglobinemia. Next, the toxicity of local anesthetic drugs. The systemic toxicity of local anesthetic drugs can affect both the central nervous system and the cardiovascular system, especially when high dose are used or when the drug is accidentally injected into the bloodstream. Early signs of toxicity include symptoms such as dizziness, tingling sensation, metallic taste, and tinnitus, which may progress to seizures and coma in severe cases. The management of local anesthetic toxicity involves immediate discontinuation of the drug, administration of oxygen, control of seizure, using benzodiazepines, and the use of intravenous lipid emulsion, thereby in severe cases. So here the local anesthetic drugs are highly effective agents that provide pain relief by blocking sodium channels and preventing the transmission of nerve impulses, thereby allowing medical procedures to be performed without causing discomfort to the patients while maintaining consciousness. And here I will explain some clinical cases for your understanding. Okay. So, a 28-year-old male patient comes to the emergency department with a deep cut injury on his forearm after a road traffic accident. The wound is actively bleeding, and the doctor decides that suturing is required immediately. So, the patient is conscious, alert, and oriented, but he is anxious and afraid of pain. The doctor now has to decide how to manage the pain before performing the procedure. At this point, I want to ask you a question. Should the doctor give general anesthesia to these patients, or should the doctor use local anesthesia? As in this situation, general anesthesia is not required because the procedure is minor and localized. So, giving general anesthesia would expose the patient to unnecessary risks such as respiratory depression, cardiovascular instability, and prolonged recovery time. Therefore, the most appropriate choice is to use a local anesthetic drug to block pain only in the affected area while keeping the patient fully unconscious. Fully conscious. So, here how the doctor select the drug. Yes, the doctor decided to use lidocaine, which is one of the most commonly used local anesthetic agents due to its rapid onset of action and moderate duration. So, lidocaine is preferred in this case because the procedure is short and the drug provides adequate pain relief within a few minutes of administration. The doctor cleans the wound area and prepares for local infiltration anesthesia. The lidocaine solution is drawn into a syringe and a small amount is injected into the tissue surrounding the wound. The technique is known as infiltration anesthesia, where the drug is directly injected into the tissue to block the nerve endings in that specific area. Once the lidocaine is injected into the tissue, it begins to diffuse through the surrounding area and reaches the nearby nerve fibers. The drug then penetrates the nerve membrane and enters the nerve cell, where it binds to voltage-gated sodium channels present on the inner side of the membrane. By binding to the sodium channels, lidocaine prevents the entry of sodium ions into the nerve cells. As a result, depolarization cannot occur and the action potential cannot be generated. Since the action potential is not generated, the nerve is unable to transmit the pain signal from the site of injury to the brain. Even though the tissue is being manipulated during suturing, the patient does not feel pain because the signal is blocked at the level of the nerve. After a few minutes of injection, the doctor tests the area by gently touching the skin and asking the patient whether he feels pain. The patient reports that he does not feel pain, although he may still feel some pressure or touch sensation. This confirms that the local anesthetic has effectively blocked that pain fibers. This situation demonstrates the concept of differential nerve block, where pain fibers are blocked first, followed by temperature and touch, while motor function is preserved for a longer time. That's why the patient can still move his hand but does not feel pain during that procedure. So, in some cases, the doctor may choose to add adrenaline to the lidocaine solution. So, adrenaline causes vasoconstriction at the site of injection, while reduces the blood flow and slows the absorption of the drug into the systemic circulation. This results in a longer duration of action and reduces the risk of systemic toxicity. However, in this particular cases, if the wound is located in the area supplied by end arteries, such as fingers, the doctors must avoid using adrenaline because it can lead to tissue ischemia and necrosis. Now, let us consider a complication scenario. If the doctor accidentally injects the local anesthetic directly into your blood vessels instead of the tissue, the drug can rapidly enter the systemic circulation and it reaches the brain and heart. This can lead to systemic toxicity. In such a situation, the patient may initially complain of Symptoms such as dizziness, ringing of the ears, metallic taste in the mouth, and tingling sensation around the lips. As the concentration of the drug increases, the patient may develop seizures due to excessive stimulation of the central nervous system. In severe cases, the drug can depress the cardiovascular system, leading to arrhythmias and even cardiac arrest. So, if toxicity occurs, the doctor must immediately stop the administration of the drug and provide supportive care. So, oxygen should be administered and seizure should be controlled using benzodiazepines. In severe cases, intravenous lipid emulsion thereby is given, which acts as a lipid sink and helps to remove the drug from the tissues. Now let us modify that cases slightly. Okay, suppose this same patient comes with an infected wound where the tissue is inflamed and acidic. In this situation, the effectiveness of lidocaine may be reduced. This happens because local anesthetic drugs need to be in a non-ionized form to penetrate the nerve membrane. In acidic conditions, a larger proportion of the drug becomes ionized, which cannot easily cross the membrane. As a result, the drug fails to reach the sodium channels effectively and the anesthesia is inadequate. So, in such cases, the doctor may need to adjust the dose, choose a different technique such as nerve block, or treat the infection before attending the procedure. And let us take another example. A 35-year-old female patient visits a dentist for tooth extraction. The dentist injects a local anesthetic agent